Welcome to the show. So today on today's show, we have Dr. Eni. Welcome. Thank you for joining us today.
Yeah, thank you so much for having me.
It's an absolute pleasure. We're really excited to find out a bit more about what you do and obviously talk about so many interesting subjects. So first of all, just let our listeners know a little bit about you. Who are you?
So I'm Dr. Eni Kadar. I am a doctor of physical therapy and just a fitness fanatic, lifestyle, health and wellness junkie. I just love everything to do with health. I am a licensed physical therapist. I work in the United States right now, but I am Canadian. And I recently started a holistic health coaching business for women.
Love it. I love it. So aligned with what it is we're up to and the kind of episodes that we've been recording as well. It's perfect for our audience. They're going to love this one. So we're really happy that you're here.
Yes, I'm so excited.
Tell us a little bit more about how you're helping people at the moment. We're obviously going to jump in to hear a bit more about your journey very shortly, but just for people to understand, like, what is it you're really doing right now when you mention like holistic coaching? What's that all about?
Yeah, so I'm kind of doing a little bit of in-clinic work right now and a little bit of online holistic health coaching. So with the coaching, um, like I said, most of my clients are women and just women looking to upgrade or optimize their health and wellness. Like maybe they've tried things in the past, maybe they've tried diets, maybe they've tried workout programs and things just haven't worked for them. So I take more of a holistic approach and coaching them into more of a lifestyle change. So we look at not only the fitness, not only the nutrition, but we look at how that fits into their lifestyle and if they're busy, like how they can make it work for it not to feel overwhelming and for them not to fall into like the guilt and shame and everything that comes with like traditional nutrition and diet and fitness plan. And then we also look at stress. We also look at sleep and hydration and gut health and kind of everything. So that's my holistic health coaching business and what I help people with. And then on the clinical side of things, I'm an orthopedic physical therapist. So I'm working in an outpatient clinic right now. Kind of see everything. I've had my hands on a little bit of everything. My passions are orthopedics, like I said, and vestibular and concussion rehab. So I love that side of things. I help people after concussions with dizziness, vertigo, any kind of skeletal pain, spine. It's a little bit of both, but I'm passionate about both. So it's really exciting.
And you can tell, like, just the way you're talking about it, you can tell you're so passionate about it. And I love your approach. I mean, you're kind of preaching to the choir here a little bit where you're talking about like that holistic thing. And it's so good for our listeners to be able to hear somebody else so passionate about having this big picture thinking approach when it comes to our wellness and our health, because it gets lost a little bit too easily, doesn't it?
100%, yes. And even now, even I feel like it's gaining momentum and more people are talking about it. But you still like I still get people in clinic that they've had like multiple surgeries and it hasn't fixed anything. They're on multiple medications and they're still feeling the same way. So yeah, you're right. It's a big picture thinking.
Well, we'll get into a little bit more about that side of things shortly. But first of all, tell us, how did your journey lead here?
So it's a good story. It's a long story, but I'll give you the summary of it. So like I guess growing up I wasn't really athletic. I didn't play sports or anything, and I kind of just fell in love with anatomy in high school, and that led me to a kinesiology degree in my undergrad. And that is kind of really where my fitness and health journey started. So I started working out. I had never worked out before. I started eating healthier, like kind of educating myself on that. I ended up working as a personal trainer. And then it was kind of the most confident I ever felt in my body and like noticed my body changing. And it was in my early 20s. So I kind of felt like I had it like figured out. Oh, it's so easy. Just like you just eat healthy and work out. It's so easy. Why doesn't everyone do this? And then I was training for triathlons and it was great. I was like the most athletic I ever felt. And then in 2011, I had a traumatic brain injury. I fell off of a horse and suffered a concussion, a pretty serious one. And it was now looking back, I kind of saw that it was a little mismanaged by the medical system. And I was kind of at a loss. Like I had symptoms for years, and it kind of manifested as panic attacks and anxiety, vertigo, headaches, and my body started changing because of like the mental side of things and my emotional trauma, I guess you could say, from everything I was going through. And by medical standards, I was healthy. So all the scans, all the x-rays, all the blood work was normal, and nobody could really tell me what was going on. I just knew I didn't feel right. So I was I was sent to a psychologist actually who tried giving me medication, and me being super stubborn, I refused. And I kind of was like, there must be a better way. Like, I don't want to go on a medication and the side effects are exactly my symptoms. Like, that does not make sense. So for a little while, I kind of accepted that that would be my new normal, that I would just like spin sometimes in my head and I would get anxious. I just was like, this is just me now. And then I ended up like exercising more to kind of deal with the symptoms. And I ended up with over exercising, getting stress fractures. So then from then I couldn't even exercise and my weight started going up and my body image started tanking. And it just was like that for a few years. And I don't really know what the turning point was. Like, I can't really pinpoint it, but I just got kind of like sick of my own crap and decided I wanted to take matters into my own hands and figure out like how. Like, I just didn't want to live that way the rest of my life. So when I was working full time, I took some extra credits and went to my doc, and then that diving into personal development and kind of the pieces together and letting my body heal, letting my mental health heal, and kind of coming out of a fog. It felt like I hadn't been myself for so long. And then as I started piecing things together, I sort of started to feel like, oh, like this was me. This is me. That wasn't me at all. Like I just didn't feel like myself at all. So I kind of work through like holistically. I pieced it together. Like, I started working on my emotional health, working on my mental health, like looking at my exercise again, looking at my relationship with food again. And then it wasn't until then that I put it all together in retrospect, where I was like, okay, like it wasn't one thing. It wasn't just the physical, just the mental. It was everything coming together. So I kind of made it my mission, and I love talking about it because I felt like nobody was talking about it at the time. I felt so alone going through it. And it was like I was reading like so many different blogs. So I guess I made it my mission to kind of make it congruent and put it in one place for people, because at the time, I know it's a lot more popular now, but at the time nobody was talking about it in one place like that. So that's kind of what led me down this path. It's kind of snowballed from there, but it's been awesome, and I'm so glad now in retrospect going through it. Like, I don't think I would be where I am today if I hadn't gone through all that.
Nice. Thank you so much for sharing that story. It's absolutely amazing kind of to hear the process that you went through. And a lot of people are even myself, can relate to kind of having those problems, and there's always looking for a physical fix or getting obviously offered medication or injections or surgeries or all this stuff, instead of actually getting asked questions about like what's actually happening on a deeper level, what's happening on an emotional level, on a mental level. I went through physios, injections, doctors, all sorts to try and fix the chronic back pain I had. And I was trying to always think, okay, if I train more or if I eat healthier, it's going to fix it. And
Yep.
nothing ever worked. Everything works on a very, very short-term basis. But like you said, when you started to, I wasn't listening to my body, but when I started to actually listen to what was happening, like you said, something wasn't right, and started to think, okay, what could it be? And then started listening to what's happening emotionally, mentally, and these physical signs that my body was giving me was a signal to say that, okay, there's some deeper work you need to do. You need to look at your emotions. You need to look at what's happening in your head. You've got to connect all these dots together, because you can't just focus on the physical. And when that happened, that's the same sort of thing. Like everything just started to change in terms of like pain started to go, stress levels started to drop massively. It just started to become into it. Everything started to connect and everything just started to flow a lot more smoothly. So it's very interesting that yours, like what you said in your story, my issues weren't as like extreme as falling off a horse and having concussion, but the process of what you went through to figure out the answers was kind of a lot very, very similar. And it took me a while to realize that, yeah, it's the physical side of things is not going to work anymore. That's a very a small part of a much bigger picture.
Yes.
That's when it started to actually trust and listen to what my body was telling me, instead of listening to all the noise that was out there saying that, or take this medication, or go and see this specialist, or go and see this specialist. And that definitely made a big difference, because when I did start to listen, then I could ask the right questions when I did need to seek help for someone. And I knew, based on what the answers they were giving me, if it was right for me or not.
Yes.
So it was an eye-opening experience, listening to myself instead of what was going on around me.
Yes. And I so advocate for that in my patients too. I love it when they come in and they're like, I saw a surgeon, they want to do surgery, but I don't know yet. Like I want to gather lots of different information, like lots of different perspectives. I love that. Yeah.
Yeah.
It's no wonder you've ended up doing what you do, both the clinical side and the holistic coaching side. You know, it's no wonder you've ended up here. You're like probably one of the best people to help somebody that's gone through all of those issues, especially from that clinical side as well. Like it's really inspiring to hear. And I'm curious, because obviously we spoke before recording this episode today, and you talked a lot about intuitiveness and how important that is to our health. Tell us a bit more about that. I'm going to assume that that was a big part of your own journey as well.
Yes. Yes. And like you said, I like the answers I'm getting from the professionals. There was a lot of noise. Like it was like, surgeon's going to want to do surgery. The psychiatrist is going to want to prescribe medication. So yeah, you're right. Like I felt like I needed to listen to myself, just like you said about tuning into what your body was telling you. So I think it's important for a few reasons, but one of the most important reasons I think is that there's no one size fits all. So I think there is a lot of noise, and we are very externally focused a lot of the time, and trying to like kind of get the answer, hoping that someone's going to tell us the answer and it's all going to like magically click. But I think a lot of it is tuning into what you think and what you're feeling. And if it doesn't feel right and someone else is telling you like, no, that's just the way it's going to be, then keep going and keep looking for the answer, because everyone is so unique. And even like food and like what we eat and our biochemistry and our genetics and our lifestyle, like everything is going to come into play, and it's going to be different for everybody. And then the second reason I think it's important to be intuitive is there is a lot of information overload out there, and people are bombarded with information, sales pitches, and lots of social media and influencers and everything. So it's important to tune in, like you were saying, to like what your own body's telling you, and how you're feeling. If you don't think it's working, then you can pivot. I feel like, I don't know if people are trying to be nice, but they just kind of stick with things and they just kind of accept that, okay, I got this diagnosis and this is just how I'm going to be now. I think it's just important to keep, like I said, if it doesn't feel right, just keep going and keep looking for your answer and keep trying to heal. Yeah.
How would you advise somebody or suggest somebody start about being more intuitive with themselves? Because like you said, sometimes people just take it, somebody in authority is giving them this diagnosis, and therefore they just take that on and they own it and they accept it. How would you encourage somebody to be a bit more intuitive? Like what practical things, if somebody's listening to this episode, would you be able to suggest, do you think?
I think that awareness is a good starting point. So even just to encourage my clients to journal about their beliefs around their health and their identity, because I see this a lot in patients that have chronic pain, is that they've kind of adopted that as their identity. So I encourage it with awareness to start, and what you've been told, what you believe about your health, and then just getting like finding stillness somewhere and tuning in to yourself and like what feels right, what doesn't feel right. Maybe mapping out what do you want to feel like? Don't not like what the physicians and like you're saying the authority is telling you what it's going to be like, but how do you want to feel and how do you want to live the rest of your life? Like, are you okay with being on medication the rest of your life? Are you okay with your lifestyle right now, or do you want to change? Like, so I think that it's important to take the inventory, find some stillness, tune in with yourself, and maybe start researching too, and just looking at blogs and people that have gone through similar things, and look at testimonials. And yeah, there's a lot of information, but yeah, start with yourself.
I love that, because even people that are listening to this that haven't been diagnosed with anything, there's still such relevant questions and relevant actions to take, is to just be with yourself and to just tune in and pay attention. And awareness is absolutely like the foundation. I totally believe that. Like, one of the main things that we teach our clients, especially when we're kind of looking for their entry point as to what's going to help them the best given their current reality, it's teaching them how to body scan, how to actually connect with themselves. Me personally, I was always very disconnected to my body. Like you, it was very much like around fitness and healthy eating, all well and good, but actually how connected was I? My head and my heart and my body were just so disconnected. And when that come together, that's when I was able to feel all those wonderful things that we kind of have access to. So that's something that somebody listening as well can go away and do, is just literally scan your body mentally or even physically. Take your hands and just sit with where feels like it needs the attention, and they'll be surprised at what kind of answers will come in, I think, right?
Yes, it's very true.
Yeah, and one thing you said that you said about people identifying and accepting their diagnosis, or becoming, oh, this is what I am, this is who I am, I just accept it and live with it. Obviously, I didn't have any diagnosis when I was experiencing the pain. I just, obviously I had it for over 4 years. So I thought, okay, definitely chronic now, and I just used to think that was normal. I used to live with it and thinking, okay, this is normal part of life. You train a lot, you work a lot, pain is just a normal part of what's going on physically. So I just got to live with it. And it took me a while to realize I don't have to live with it. It's like I go somewhere and they say, oh, obviously again, x-rays, MRIs, all this type of stuff, but pain doesn't show up on a scan. Pain, it's not something you can see. So it's important for people to realize that you don't have to live with it, or whatever's happening, whatever diagnosis you get is not who you are. You can change that around. And I think that's where where our kind of whole health system is a bit skewed at the moment, because it's more based around trying to fix the problem instead of trying to fix the cause. So it's more reactive. So it's trying to make people less sick than they are compared to making them healthy again. So in your experience, obviously you've been doing what you're doing for a long time. So what do you think the difference is between, for example, like sick care and healthcare?
Yeah, you bring up a very great point. And with the pain science too, that's a emerging field in physical therapy too, about like you're saying, you had pain for 4 years, and MRIs and x-rays, I think of them more as like a snapshot. Like it's like a picture in time. It's not telling us the whole story. And it's exactly like you said, they're fixing the symptom. Like, okay, there's a disc bulge on this MRI, but does their pain correlate with that disc bulge? Or is it something else? Is it the muscle creating the pain? Maybe their pain signals are hypersensitive because they've been in pain for so long. So the pain science side of things definitely comes into play, and like especially with pain, back pain and things like you're saying. So thank you for bringing that up. And I think to answer your question, the difference between healthcare and sick care, I just actually posted about this because I it's so frustrating to me, the sick care side of things, because I've been through it and I see people going through it, and it just boggles my mind. So I think of sick care more as, like you're saying, is that you're treating the symptoms. It's already kind of like you're at that breaking point and something isn't right. So now we're trying to reactively like fix things. And typically in like the traditional medical model, in the Western medical model, it's Band-Aid solutions. It's throw medication at them. Let's see if it works. If it doesn't work, let's try different medication. If that doesn't work, okay, now let's send you to a specialist. What's the specialist say? Let's do surgery. Okay, let's do surgery. Now I'm on 4 different medications. Now I'm recovering from surgery too. And everything's kind of just like piling, and nobody's really addressing like, hey, well, where did this come from? Like in some cases, yeah, obviously there's some like instances where it's like a genetic thing, or maybe it is just managed and it's not something that's necessarily curable. But a lot of the time, like I think it was 70% of illnesses are preventable, like obesity and cardiovascular disease, things like that. So I would say then if you look at the healthcare side of things, it's more preventative, and it's more taking care of things before they get to that point and looking more long term versus short term. And I think that it's a societal shift that needs to happen when you look at healthcare versus sick care, because we are kind of like an instant fix society. We're used to getting things like now and quickly. So it is hard for people to conceptualize and like think like this, I have to live this way long term. It's going to take sometimes years to undo years of getting to this point. So maybe the patience comes into play too. And then the other thing with the healthcare model is how, what, like we've been talking about, is looking at a person as a whole and their whole health instead of just the symptom and putting a Band-Aid on it. Like we need to look at all of the things that have brought them to this point: mental health, emotional health, trauma, lifestyle, like everything, nutrition, and then go from there with a plan instead of just a Band-Aid.
Definitely. And I love what you said about, obviously it's a long-term focus, not a short-term fix, because that's exactly what we kind of preach all the time. It's about longevity. It's what you do now is going to have an effect in the next 10, 20, 30, 40, 50 years. And the more you keep doing it, the more, obviously, the bigger that's going to compound. So if you're not looking after yourself, by the time in 30 years time, well, God knows what's going to happen. But if you keep looking after yourself, whether it's again, physically, mentally, emotionally, and spiritually, in 30 years time plus, you're going to still be in a much more resourceful, healthy state to be able to do whatever you want. And one thing, well, what advice would you give to someone who is kind of in that sick care mentality? They're kind of trapped there. They're, anything that happens, are always getting medication or kind of seeking advice that isn't helping. What advice would you give to someone who's in that kind of situation?
I would first ask them to define what health means to them. Is that what they draw like from like the meaning of health? Is it just the absence of illness? Or is it something more? Like, how do you want to feel when you feel healthy? Do you want to feel energetic? Do you want to feel like you have some vitality? And or is it something else? Like, do you just not want to have pain? And then I would start with just whatever, like start now with whatever you have. So I think that it gets overwhelming sometimes for people that are dealing with a lot of different things, where they're like, okay, like I need to fix my diet, but I also need to sleep more, but I can't sleep. So what do I do? It's like overwhelming. So my initial advice would just be to start with what you have. Start now, even if it's just the tiniest thing, like drinking an extra glass of water, and then keep doing it. Like that's where people fall off a little bit, is that they stop. Maybe they're not seeing results, or maybe it's just a habit, but that's what coaches like you guys and me are for, is just to help overcome those barriers to continuing long term with those habits. So yeah, my number one thing I would say is just to start with where you're at and do something tiny.
I love that, because it's so easy sometimes for people listening to think, well, okay, well, that's their story, that's not me. But actually, at the end of the day, we're all human, and we all need to build these habits step by step. None of us just wake up in the morning and suddenly everything changed. I mean, maybe like 1% of people actually function that way, but it's very rare. And usually there's something extremely significant and traumatic that pushes somebody in that extreme direction. but for everybody else, just knowing that small thing makes a big difference. One of the things that we often advise as well, and it's really based on our personal experience and a lot of studies that are out there, which is on how sleep is so important, because a lot of people, they know, they understand that they should exercise and they should move more, and it's something that is just so almost ingrained that it's like, yeah, we know, but we don't do it, and it's almost like that's acceptable. And that then obviously goes into beliefs and what do they think about their own health, like you've already mentioned. But what is your take on how important sleep is when it comes to somebody that's taking care of their health, or even if they're in a case of sickness?
It's foundational. It's I think it's one of the biggest things, if nothing else, and just like solidify your sleep. And then it's just been linked to so many things in research, like anxiety. There's don't quote me on this, and we might need to fact check this, but it's like a couple hours lack of sleep is a 40% increase in anxiety symptoms the next day. Or even productivity for people who are busy and people who are working really hard. Sometimes it's kind of counterintuitive. You think maybe I should cut in my sleep so that I can be more productive, so I have more time. But I think the opposite is actually true. You're more productive when you sleep more. And even clients that have health and fitness goals, you have less willpower and less motivation when you aren't sleeping. So you're making it harder on yourself to reach your fitness goals. If you are on a weight loss journey or on a healing journey, lack of sleep is going to affect every part of your like waking day, like what you're eating, how hungry you are, your energy levels. And if you're somebody who's healing from an illness or an injury, sleep affects your healing process, and your perception of pain is amplified if you're not sleeping. So it's foundational.
I love that you were saying that, purely because it's something we talk about all the time. Like such a good return on your investment for the effort you make in getting your sleep right. There are just so many more benefits that are attached.
Yes.
What would you suggest to people listening if they are struggling with sleep and now they're understanding actually is this foundational piece, no matter where you are in your health journey? Is there anything that you would suggest in terms of getting them on track with that sleep?
Yeah, there's a few different tools that I recommend. It depends on the person, what works best for them. I've had clients have good success with, there's a free app called Oak that has a like a sleep sounds, but you can get it anywhere. So I recommend like setting up your environment first. So you've probably heard of like the cave-like environment. You want it to be dark, you want it to be on the cool side, and ideally no work distractions or like no exercise equipment in the room. Like it's your haven. So environment first, and then some sort of sleep routine, because our brain is very associative. So if you have a little routine that you go through before bedtime just to wind down, then that will usually trigger you to get a little sleepy when you're in bed. When you get into bed, no work in bed, no phones in bed. That's the hardest thing for people. So we just want to fall asleep with our phones in our laps, I guess. I don't know. And the caffeine is a big one too. People having caffeine like into the afternoon, that'll affect your sleep. The sleep sounds will help you wind down, or even breath work before sleep, just to like cue your body to relax and get into that state. And then just staying on a schedule with sleep is important too, as I think it's maybe a little more difficult for people that do shift work, but for the most part, trying to get to bed and wake up at the same time every day is surprisingly something not a lot of people do. But it does help a lot.
Absolutely, and like all of those tips are so useful. Obviously together they're incredible, but like we said earlier, if you just pick one of those amazing things that you just mentioned, then they're already going to start to see changes if they stick with it. Brilliant.
Yes, that's the biggest thing, like sticking with it.
Exactly. What like we could talk about all of this for hours and hours, but I'm curious to know, what one thing you wish that everyone could understand about themselves?
that they have more power than they think. And even just with their mind and their belief, like, yeah, that's one thing, as I wish that people understood how much possibility there is and how much power they really have to change their situation and change their lives. And it all starts with their mindset and what they're thinking. And I wish that more people understood that and like stopped limiting themselves so much in any area of life.
Amazing.
Awesome. That's awesome. Absolutely amazing. And I know you've given already a lot of amazing advice so far, and tools that people can go away with and use. But if you had to kind of narrow it down, what one piece of practical advice would you give to someone, well, to anyone listening, and why?
I would probably along the same lines of what I just said, because I just think it's so important. I think, yeah, one piece of advice would be just to make a decision and make it a habit. Like, just it starts with one decision, and it can be moment to moment, and it doesn't have to be perfect. It doesn't have to be this like dramatic, huge lifestyle overhaul. It can be just one little tiny decision, and just keep making that decision and keep choosing yourself, and whatever that is with your health, or if it's a dream or a goal or whatever, just make one tiny decision every single day that gets you closer to that goal, and just keep doing it. Just don't quit. That's the biggest thing.
Awesome. It's very, like I say, it's very, very on point with what we tell our clients. Is again, just it's as simple as making a choice. Really, you can change your life
Yes.
and get the life you want by just making a simple choice every single day to take action towards what you want. And again, it can be something as small as just drinking a glass of water, up to, well, it can be as big as you want it to.
And
Yeah.
staying with it, like you quite rightly said, it's so easy for us to choose. We can make the choice, but often when we make a choice that isn't probably serving us in the best way, we have this tendency as human beings to just be so hard on ourselves. Rather than just continue to make good choices thereafter, we kind of get hung up and stuck in this place of judgment and almost like they need to give up now. But one poor decision does not counteract 100 healthy small decisions. So again, it's so important to move past those little barriers as well, because it's like the metaphor of climbing a mountain, isn't it? It's like you suddenly look back and you see how far you've come, and that's exactly the same when we make tiny changes, isn't it?
Yeah. And that's something I tell my clients is like one workout isn't going to make you an Olympian, just like one meal isn't going to derail weeks and months of progress. It's that all or nothing mindset. And that's so common. Everyone, so many people think that way, but you're right. It is just, it's one decision, either direction. It's just a decision. And we overthink it sometimes.
Exactly. We can always come back to the decisions that serve us at any moment.
Exactly.
Dr. Eni, I've got another question for you. Just in your own like personal life and experience, what is the biggest like new belief or behavior that's most improved your life in the last, say, 5 years?
It is the belief that I am worthy and that I have the power to control anything in my life. And it just going back to like even going back to school, I was so stuck in the mentality that like I was just a victim of my circumstance. I didn't come from money, so I would never really do anything that I wanted. And it was just like, now looking back, I'm just so floored that that was me and that's how I thought. I never took my power, and I never just took advantage of like all the possibility that there is out there. I just, again, like I was accepting that that's just the way it was. And that has led me down so many amazing paths, just taking back my power, and I'm knowing I'm worthy of success, and knowing I'm worthy of health, and I'm worthy of all of these things, and that it's not um we're not limited. Like we're not, there's no cap. Like you could just do whatever you want. There's nothing really, like obviously within moral standing. You could do whatever you want, but it just feels surreal to think, and I think it's scary for people to think that they do have that much power over their lives, and it can be overwhelming to think that like everything that's holding you back is just like there's a way around it. You can think your way out of it. You can figure it out.
Absolutely. And that's led to you sharing your power with everybody else, because the amount of people that are empowered and inspired by not only your story, but the incredible work you do as well is astounding. And if you didn't have that belief in yourself, like there'll be so many people missing out on that. So I think it's beautiful. And thank you so much for sharing that, because I think that's something that a lot of people take on board and learn from themselves, and maybe have a little reflect on how they feel and how their worthiness can just expand other people's minds and lives as well.
Mm-hmm. Thank you.
Excellent. So, Dr. Eni, before we wrap up, is there anything else that you would like to say to our audience? Anything you'd like to, that you haven't said already, or that you've got just sitting there that you might, any nugget of wisdom you might want to put out into our audience?
A nugget of wisdom. I've been really into the mind-gut connection lately and the vagus nerve. Have you guys been diving into that? Yeah, so there's just so much evidence coming up now. It's so interesting. So yeah, I think a little nugget of wisdom, I've been recommending this to my clients, is getting on a good probiotic. that's
a little segue there into the next episode when you come back on the show. In detail, for sure.
Yeah, that's definitely something that I know I'm reading into at the moment, is the mind-gut connection, because it is so powerful how the two connect together and talk to each other, and how one obviously doesn't work without the other. So it'll definitely be interesting to get you back on again to have do a little podcast about that as well.
I would love that.
Amazing.
Excellent. Yeah. No, that's good.
Cool. So, Dr. Eni, where can our listeners find you? Where, if they like really want to learn more about what you do and follow your journey even more, like where can they reach you?
So I'm on Instagram I'm on Instagram as Holistic DPT. So that's HOLISTIC DPT. I'm also on Twitter, and my website is www.holisticdpt.com. They can find me there. I post almost daily. I post everything holistic health and fitness. I post workouts and everything. So they can find me there.
Perfect.
Awesome. Well, it's obviously been an absolute pleasure to have you on the show. Like, just listening to your story and everything you've had to say has actually been absolutely amazing, and it's been great for us to listen. So it's definitely been great for our listeners as well, who are going to hear everything you have to say. So thank you very much for coming on.
Yes, thank you so much for having me. This was really fun. It's so much fun connecting with like-minded people.